Bismillahirrahmanirrahim. Today we are starting a new course of pathology. First chapter. This course is prepared from the Robbin textbook. The first chapter is cell pathology and aging. Normally, the first chapter is a cell. So first we will discuss some basic information about the cell. For example, this is a cell. Normally, it receives 20 milligram per dl of oxygen. Let's suppose if instead of 20 milligram per deciliter of oxygen, the cell receives 18 milligram per deciliter of oxygen, it means that this is a physiologic stimuli. Now that there is some alteration in the physiologic stimuli, means instead of 20 milligram per deciliter of oxygen, the cell is now receiving 18 milligram per deciliter of oxygen. Now the cell will show what type of response. This is called cellular response. When a stimuli is altered, means the physiologic stimuli is altered, so the cell shows some response. When a physiologic stimuli is altered, it is called non-lethal stimuli. Physiologic stimuli alteration is called non-lethal stimuli. The cell would go for adaptation. How the cell will adopt? The cell will adopt through atrophy, hypertrophy, hyperplasia and metaplasia. So if someone asks from you what is hypertrophy, simply you will answer that it is a cellular adaptation towards altered physiologic stimuli. If somebody asks from you what is metaplasia, you will answer the same question answer, the cellular adaptation to alter physiologic stimuli. So when a cell is receiving, let's suppose 20 milligram per dl of oxygen, but now the same cell is receiving 18 milligram per deciliter of oxygen, it means that there is alteration in the physiologic stimuli, and that type of alteration is called altered physiologic stimuli. And the altered physiologic stimuli is also called a non-lethal stimuli, and the cell would go for adaptation through atrophy, hypertrophy, hyperplasia and metaplasia. So this is the first type of stimuli. Now the second type of stimuli is lethal stimuli, means the same cell is receiving 5 milligram per dl of oxygen instead of 18 milligram or 20 milligram. Now the cell is receiving 5 milligram per dl of oxygen, so it is a very little amount. So now we would not call it altered physiologic stimuli, but instead of altered physiologic stimuli, it is lethal stimuli. So now it will depend upon the time whether the lethal stimuli is for a short duration of time or it is for long duration of time. If the lethal stimuli is for a shorter duration of time, it means the cell will go towards the injury, but this cell injury is reversible. And if the stimuli is for a longer period of time, persistent period of time, the cell would go for injury, but this type of injury is irreversible injury, and irreversible injury means that the cell is now going towards death, and the cell death would happen. And if the cell death is happened, so now what type of morphological changes you will see, I mean by how you can say that the cell death is through apoptosis, through necrosis, through necroptosis, pyroptosis. So it means that if the cell is going towards irreversible injury, the cell death would be happened through pyroptosis, necroptosis, apoptosis and necrosis. So if somebody asks from you what is apoptosis, it's simply it is a cell death. It is a cell death because of the irreversible injury. What is necrosis? It is a cell death because of the irreversible injury. Lethal stimuli for persistence duration of time, for longer duration of time, it means that irreversible injury. Now a third is chronic injury stimuli. How the chronic injury stimuli will be developed? It is very simple, that the chronic injury stimuli will be developed upon the accumulation, intracellular accumulation. Means then this, it means that it is a cell and there is accumulation of fats, calcium, glycogen or protein occurred. So now what type of injury we will call it? Chronic injury stimuli. Intracellular accumulation by fats, by glycogen, by proteins and by calcification. Now the fourth type of stimuli is sublethal stimuli, means below the level of the lethal stimuli. Means below the level of lethal stimuli, not a lethal stimuli. Below the level of a lethal stimuli is called sublethal stimuli, and if it is for persistence duration of time, it means the cell will go towards aging. So very simple, quickly we revise that as if the stimuli is altered, the cell will show a response, and it is called cellular response. It is by four phenomena: altered physiological stimuli, lethal stimuli, chronic injury stimuli, sublethal stimuli. You will look whether the cellular adaptation is going on, whether reversible injury is going on, whether irreversible injury is going on, or accumulation of the intracellular fats, glycogen, or aging is induced. So if aging is induced, your answer would be sublethal stimuli. If irreversible injuries happen, it means the lethal stimuli for persistent duration of time. So first we will discuss cellular adaptation in detail. What is mean by cellular adaptation? Cellular adaptation simply means that stimuli is coming towards the cell. So how the cell would adapt? The cell would adapt itself through increase or decrease in number, increase or decrease in the size, increase or decrease in their shape, phenotype, or increase or decrease their functions. So the cell would adapt itself through number, size, phenotype, or function. If you remove the same stimuli, means instead of 18 milligram per deciliter of oxygen, the cell is now receiving 20 milligram per deciliter of oxygen. So the cell would come back towards the normal state. And remember, cellular adaptation are reversible. Cellular adaptation are reversible. If somebody asks from you that the cellular adaptation is pathologic or physiologic, your answer would be it is both physiologic and pathologic. It is both physiologic and pathologic. And if someone asks from you what is the example of physiologic, your answer would be pregnant uterus. And if somebody asks from you the example of pathologic cellular adaptation, your answer would be Barrett's esophagus. So simple. What is cellular adaptation? When altered physiologic stimuli is coming, the cell adapt itself through change in their number, size, phenotype, or function. And it is both physiologic and pathologic. Now, cellular adaptations are four types: atrophy, hypertrophy, hyperplasia, and metaplasia. First of all, we will discuss about hypertrophy. First, we will discuss about hypertrophy. What is meant by hypertrophy? Hyper means increase. Increase. Hypertrophy. Hypertrophy means increase. Increase in what? Increase in size or number? Increase in the size of the cell. Increase in the size of the cell. Not the number. The number will still remain the same. It is called hypertrophy. Your answer must be increase in the size of the cell, not number. I am again and again emphasizing that only cell size would be increased for adaptation. If only the size of the cell is increased for adaptation, it means it is a hypertrophy. And by what mechanism cell will increase in its size? Through increase in the synthesis of proteins. Increase in the synthesis of protein is called increase in the synthesis of protein. In which process? Hypertrophy. So only the cell size would increase, the cell numbers would not be increase. The cell numbers remain the same. So if somebody asks from you hypertrophy is physiologic or pathologic, as I already discussed, that the cellular adaptation is both physiologic and pathologic. So your answer must be what? Your answer must be what? Both physiologic and pathologic. If somebody asks, please give me the example of physiologic hypertrophy, your answer would be pregnant uterus. Pregnant uterus. In pregnant uterus, there is a cell number increase and the cell size also increase. So one important point about that it is both hypertrophy and hyperplasia. We will discuss that hyperplasia means increase in the number of the cells. So in pregnant uterus, there is the size increase, there is the number increase. So the size increase is called hypertrophy and it is a physiologic example. But remember, pregnant uterus is both physiologic and pathologic, and most frequent asked question is this one. And if somebody asks from you that give me, doctor, example of pathologic hypertrophy, your answer would be cardiac enlargement due to valvular defect. Means the cardiac size increase. Valvular defect we will discuss in CVS system, but still you have to know you have to know this point, that the cardiac enlargement is not a physiologic process, it is a pathologic process, and it is hypertrophy. Now let's move towards the hyperplasia. What is meant by hyperplasia? Hyperplasia is, I already discussed, the number of the cell increased but the size of the cell not increased. Only the number of the cells are increased, but the size of the cell remain the same. It is called hyperplasia. And by what mechanism? As we have discussed, and hypertrophy, there was a mechanism of increase in the cellular protein, and here the mechanism is increase in the growth factor. Increase in the growth factor means that increase in the nuclear transcription factor, and when nuclear transcription factor is increased, it means that there is a increase in the cellular proliferation. And the second mechanism is increase in the tissue stem cell, and increase in the tissue stem cell means increase in the number of the cell. If someone asks from you that whether hyperplasia is physiologic or pathologic, I again and again emphasizing upon this point that cellular adaptation is both physiologic and pathologic. If someone asks from you, doc, please the physiologic example, your answer would be pregnant uterus. As we have already discussed, that pregnant uterus is the example of hyperplasia and hypertrophy both, because cell size and number both increase. The second example, if someone asks, pregnant breast, the breast, because in a breast number of the cells are increased but the size is not increased. If someone asks from you that compensatory hyperplasia, that compensation take place, liver regeneration after liver resection. When you do liver resection, the liver again regenerate by itself. So the liver increase in the number of the cells, the liver size is the liver number of cells are increased. It is example of physiologic, and it have a special name, compensatory hyperplasia. If someone asks from you that can you give me, doc, the hyperplasia pathologic example, you will say increase estrogen on the endometrium. Increase estrogen on the endometrium. When more estrogen is going towards endometrium, it will induce endometrial hyperplasia. But remember, endometrial hyperplasia is a pathologic, and it leads towards a cancer called endometrial adenocarcinoma type 1. Endometrial adenocarcinoma type 1. After this lecture, we will discuss atrophy and metaplasia. We will cover the whole pathology from Robbin textbook. If you have any kind of a question, please ask your question in the comment box, and I will provide the same lecture PDF in our WhatsApp channel. So please join our WhatsApp channel, and I guarantee you will cover Neet PG exam or USMLE Plab, whatever, any type of exams you will cover from our these lectures. Just listen these lectures with complete care. Thank you so much.